We're very proud to present the Atlas, a very comprehensive agentic AI generative model that covers all 35 specialties of medicine and surgery. The initial interface is very similar to other generative platforms. However, in this case, you can choose any 35 specialties of medicine or surgery to get a very deep answer to any of your questions. The previous questions are listed on the left side. In this case, a question was asked from a neurologist regarding medial temporal lobe epilepsy. Atlas provides reasoning behind every answer, which can be quite effective to provide the user with additional education and confidence regarding the reasoning behind every question. We have a very specialized clinical reasoning model that can provide incredibly deep and effective answers. The answer has all the sources referenced for every piece of information, and the user can click on any of these links to be able to be directed to the original source. As I mentioned, the answers are very deep in terms of being in the context and logic of the individual specialist. Guidelines are heavily weighted in the answer. The sources, including with the guidelines first, are mentioned on the right side. Another special feature of this platform is that you can automatically get a consult from any of the other 34 specialists on the platform to be able to get additional insight regarding your management strategy. In this case, for medial temporal lobe epilepsy, automatically the question is passed on to the neurosurgeon to be able to provide the reasoning behind the answer with the sources, and also provide the answer regarding management of this patient. This agentic consultation is very effective in the clinic for the clinician to be able to get insight from any other specialties of medicine to effectively direct the care of the patient.
I'm Rich Byrne. I'm chairman of neurosurgery at Mayo Clinic, Florida. I have been using Atlas for subspecialty decision support since the release of Atlas. We have been using it in our department. Multiple members of my department have been using it. I find it to be an excellent resource for complex decision-making in neurosurgery. Other products on the market, I think, are also useful, but I think better for general medicine, but for subspecialty decision support, Atlas has been our go-to.
We physicians are busy and need access to reliable and in-depth consultation across all specialties of medicine. Atlas does just that. It's much more comprehensive and friendly to use compared to up-to-date and open evidence, and I highly recommend it.
A head-to-head comparison of the Atlas to up-to-date, Dynamed, Open Evidence, ChatGPT, and other medical domain AI systems demonstrated that the Atlas is significantly superior in terms of its reliable and robust answers that are consistently accurate versus other systems that demonstrated inconsistency regarding the accuracy and the depth of their answers. Atlas was able to provide deep subspecialty level responses that were the best fit for clinical workflows, contextual for every specialty of medicine, providing excellent peace of mind for every clinician to make sure they're making great decisions for their patients.